Savvy Business Radio, drawing out the best from our guests with our host, Christina Nichman.
Our guest is Dr. Truong, author of Erectile Dysfunction Fix, which has helped thousands of men ease erectile dysfunction and enjoy intimate relationships once more. Her treatments involve Platelets Rich Plasma, which uses the body's own blood and innate healing abilities to mend injuries and treat ED. Find out more about Dr. Truong at truongrehab.com. That is Truong rehab.com. Hi, Dr. Truong. Welcome to Savvy Business Radio. How are you today?
I'm fine. How are you?
Oh, I am doing very well. Even better to have you here with me today. You are the author of Erectile Dysfunction Fix. You'll probably be the first person on our show to talk about this very important topic. It doesn't get enough exploration, I would say, but it's something that affects both men and women. If you're in a partnership with a man or a husband, it'll affect your relationship. But you've also going to come to the table and talk to us about pain management and how you've helped your patients deal with alternative to using opioids or pain medication. So I'm excited to have you here. You're also appointed the Women's Entrepreneur Ambassador by Women's Entrepreneurship Day organization, WEDO, which is awesome. So I'm so happy to have you here. Share with our audience a little bit about your backstory and what brought you to this whole world of helping people with pain management and erectile dysfunction.
Well, thank you for having me on the show. My journey started a few years ago. I'm a pain management doctor who focuses on treating the source of the problem rather than the symptom. Mm-hmm. So since I started my practice in 1997, I just felt that I need to do more for my patient rather than giving them a medication and do an injection. I wasn't making a long-term impact. Mm-hmm. So I wanted to explore something that treat the cause of the problem. So I looked into Platelets Rich Plasma, which is using your own blood to help you heal yourself. We all have capability to heal ourselves. We just need a stimulus to do that. So my journey started in using this to help with pain, like for instance, inject it into the knee or the spine or the hip for pain management. Mm-hmm. And as I was doing this, I explored that you can put the platelet-rich plasma to help for aesthetic and also for sexual dysfunction.
Wow.
And most of my patients are actually male who has pain and has erectile dysfunction. Mm-hmm. So, we have tried doing PRP injection into the penis, and has found that it's been helpful to treat erectile dysfunction for long term, that they don't have to take medication, and it really does repair relationship, improve their self-confidence, and change their life. And on top of that, we also do hormonal replacement therapy to optimize the result. So the result is treating the condition at the source of a problem and without medication or surgery.
I love that. That often what frustrates me when I've gone to the doctor is I have a problem and they're like, the first problem in my 20s, I was having weird, irregular periods. And they're like, okay, here's some hormones. I'm like, well, can we find out why it's happening? It turned out that it took another 5 to 6 years to find out if I had thyroid issues. And then their idea was, well, put you on anti-thyroid medication because I have Graves' disease. And then shortly after that, okay, it's not working. Let's just rip it out. And I'm like, there's got to be a better way. What has caused this to happen? So I love that the fact that you're going to the core of the problem and let's have the body heal itself. Now explain, why would using platelet-rich plasma help? How does that work? What is the platelets anyway?
Right. So platelets come from your blood. And if you cut yourself, the first thing that comes to area is your blood. And in your blood, the platelet floats around in it. And what it does is stimulate the body to start healing itself again. So like when you have a cut, the blood goes in there and tissues start to migrate to area to start filling in the cut and healing it and creating a scar. Wow. So what I do is I get the blood from your veins and put it in a centrifuge, and we separate the blood and isolate the platelets. The platelets are like little balloons that float around in your blood, and all they do is stimulate a healing response. So when I put in a centrifuge, I just separate out the platelets and put that and inject that into the area of injury or the area of dysfunction to stimulate the body to heal again. And that's essentially stimulating blood vessel to form to bring new blood to the area.
Oh, interesting. So is it kind of part of the whole immune, what do you call it? The healing factor of the body, like the blood cells, is it part of that function, or does it stimulate?
Yes. Well, it's part of the wound healing cascade that all of us have. It's just skipping the part of the injury. So instead of, you injuring yourself, I'm just taking the blood and put it into the area and to start the repair response. So you already have that in your body. It's just that when you have an injury, let's say to your knee, there's no vascular response. There's no blood vessel nearby to bring in the blood. So what we're doing is we're bypassing that step and just putting in the PRP or platelet rich plasma into the area to stimulate your body to repair.
That's amazing. Now explain for people, I don't know much about erectile dysfunction to begin with. What are some of the causes of it and what exactly is it?
Well, erectile dysfunction can actually affect men from 20 to 80. And currently, the prevalence or the population affected is 30 million men. So it's not a small population. And it ranges from not having an erection to premature ejaculation to not maintaining firmness. So it's not just a problem of older men. And so it starts sometime early because of medical issues like diabetes, high blood pressure, high cholesterol, and even psychological trauma. So with all those factors together, it compounds the severity of the problem.
Wow.
And so you can get it early, you can get it later. And the point of my book is to point out these risk factors so that men can seek help. And if you seek help early enough, it actually can be reversible. If you seek help later on in life, there may be too much damage that is not reversible. So most men with ED, they revert to taking Viagra, Cialis, medication, but there are other natural alternatives without having to take the medication.
What kind of issues happen that's irreversible? What does it do to your body that you can't fix it anymore when you get to a certain point? What ends up happening?
Right. What happens is that the circulation to the tissue, for instance, to the penis, is so impaired with high blood pressure and diabetes that it doesn't hold up the blood vessels. So what happens is that you have less and less blood flowing to the tissue, and it comes to a point where the tissue is dead and you can't restart it to heal again. Wow. So if you start early, there are more tissue to heal. But if you start too late, there's no building blocks and there's no what we call like a scaffold that can initiate the healing process with the PRP.
Wow. And we had started out the conversation that you really help with a lot of these disorders, pain management being the root or the one of the major symptoms. How does platelet-rich plasma help in the dealing of joint pain or just pain management? How does it do that?
Well, what it does is the same thing with treating erectile function,
Okay.
but one step further is that the platelet-rich plasma can calm down inflammation. And a lot of the reasons why you have pain in your joints or in your ligaments or tendon is due to inflammation, and which means that your body continuously become inflamed and secretes all the toxic substances that cause your pain. So the PRP, when injected into a painful area, decrease the inflammation. And when that happens, it allows the area or joint to allow a positive healing environment to start healing again. And that's what the platelet-rich plasma does, is that it calls for the tissue, the normal tissue, to be deposited into the injured or painful joint to start the healing process.
Wow. This is really fascinating to me because so many people I talk to in my age, I'm near 50, talk about the aches and pains throughout their body. A number of them have a lot of autoimmune diseases, from mine, which I had, which is now stable, Graves' disease, to other thyroid issues, to Crohn's disease, whatever it might be. And they're like, oh, I guess it just comes with old age. And I've even gone to doctors for certain pains. Well, it just comes with getting old. Do you agree with that? Is it really an old age thing, or is inflammation?
Actually not. That's that's the old thinking. What we're finding out is that inflammation is the root cause of many diseases. Your genetics, sometimes it's kind of like this. Your genetic load the gun, but what happened as you grow up in your environment and your lifestyle and diet is what sets it to whether the gun goes off or not. So a lot of inflammatory conditions like thyroid, diabetes, all of that, even depression, anxiety, all stem from inflammation. And that stems from your gut and what you eat, your lifestyle. All of that is contributed to your inflammation level. So it really starts from healing from the inside out and calming down the inflammation.
Wow, Dr. Truong, this is amazing. I've talked to a lot of my friends who, when they get to the 40-year-old range, they start thinking and paying attention to their body. And when we haven't beforehand, I used to do crazy hours around the clock working, just abusing my body, eating whatever I wanted, not really thinking about it. And the same with my friends. But we hit 40 and we start listening to our body, saying, okay, it makes us listen, as it were. But I hear some of my friends say, hey, I'm eating salads all the time. I'm even going to the gym. I'm not losing weight. I still feel awful. I feel fatigued. But you know what I noticed a big component is that they're still under a lot of stress. How much does stress play a part in all of the inflammation or some of these autoimmune diseases?
Well, you hit it. I mean, stress is the big component of affecting how your body responds. So if you're stressed, your body releases a stress hormone called cortisol. And cortisol is released in your brain and your adrenal gland on top of your kidney. And cortisol affects blood sugar and also affects blood pressure. So if you're continuously stressed, you have blood sugar imbalances, which causes insulin resistance, which causes weight gain, which also causes difficulty in losing weight. And the cascade also affects your male and female hormones as well. And also because cortisol also elevate blood pressure, it leads to, high blood pressure, heart disease, and even contributing to high cholesterol. So stress is not the only thing that causes that, but certainly lowering it will help your risk.
Greatly. Wow. Well, it goes to say, because some of my friends, I see them really, really trying, and that they're doing everything they think they can do, which is eating better, going to the gym, those type of things, paying attention to what goes into their body, but they're not really paying attention to the stress around us or how to deal with it. When you work with your patients, if you see they're under a high level of stress, do you have any suggestions for them to kind of beat that?
Yes. What I do is I educate exactly what I tell you. And once they know about that, and if they want to get better, they need to start realizing that I need to have life and work balance. Because that's the only solution other than taking medication for depression or anxiety or even diet medication. Those are just short-term and not long-term. What I do is I educate them and I just tell them to put their priorities. Well, what are their priorities? Like, if you were gonna have 2 weeks to live, what would be the most important things in your life that you want to reflect upon? Nobody ever says, I wish I worked more.
Absolutely. Yeah.
They have to put what their priorities are and to design their solution based upon that. We all want to work hard. We all want to do well, but we need to put it at a balance and knowing how to manage that. So I just kind of have them look at that. And if they see what their priorities are, they will want to make the change. Because if I tell them what to do, it's harder for them to do. But they have to want to do it because they want to spend more time with their family, because they want to be able to spend more time with their grandkids, be active, have a better lifestyle. Because I tell my patient, if you keep going the way you are, you run risk of having a heart attack, having a joint replacement, and you're not going to be active, and you're not going to have the lifestyle that you want later on in life. Because right now, the life expectancy in the United States is around high 80s, or even probably in the next 10 years, even into 100. So you got to take care of your body now. Is your temple. You don't take care of your temple, it's not going to take care of you later on. So do you want to, get old with, be able to walk and enjoy your family and enjoy the revenues that you make from your work? Or you want to work a lot hard now and then not have the body you want later on? So I put it in that perspective.
Yeah, it's kind of hard to see, but when you make it real, like if you say, and I've thought of this myself, if you literally knew you had maybe even a year to live, would you be living the same way you're living today? Would you be working 20 hours or not 20 hours, 16 hours a day, not seeing your family? Would you be doing that? Probably if you knew you had an X amount of limited time and you knew when your time was up, you would probably change your schedule completely and go home and be with your kids, because in a year you won't be there for them. It's really an interesting perspective. Now, interesting, before I got on the call with you, my partner had said he knew I was coming on with you, and he said, so does having more sex help in maybe getting erectile dysfunction if you keep yourself active? Because I've heard more and more people who are married or in long-term relationships that being sexually active goes down over time. Does it help
I'm so glad you asked that, because there's been a study that's recently came out that shows that people that had more sex during the week are healthier, have better quality of life, and are more productive as well. So it is actually a stress reduction as well. And it also increases your calories as a form of exercise.
And it's interesting because when I went to the doctor, she had told me, I was eating packaged food, but, so-called healthy packaged food, healthy choice or whatever. And she's like, make your own food. I'm like, oh, but I'm busy and I work 12 hours. And she's like, listen, do you watch TV in the evening sometime? Do you do this or that? Think about the time you do stuff that's not important to spending a half hour putting a meal together that's fresh. That is time well spent for your body. And that goes along with what I've heard people say with the kids and whatever. I don't have time to go have intimacy with my husband. I'm too tired. But if you think about, just spending time, an hour or half hour, that you really choose to be intimate with each other, allows you that, as you say, stress reliever, and allows you both to be healthy and build your intimacy together.
Right, and that's really the point of my book. It's not just all about ED, it's about relationship and building your relationship and intimacy with your partner again, and that intimacy, such as sex, is an important part of that. So that's when we get started when we were young. And it kind of wean away when we get older, and we just blame it on, oh, I'm just old, it's not working. It's accept that. My point of my book is that sexual relations important to your life, to your spouse, and that you're just not doing it for yourself, you're doing it for your relationship. And it can be treated if you recognize it early, and you have to seek treatment, because there are 30 million men out there that has ED that are not seeking help or just resorting to a quick fix with medication. But there's a lot of side effects with the medication, such as high blood pressure, dizziness, flushing, and even heart attack.
Whoa. So actually, I'm assuming one of the biggest reasons a lot of men don't come forward with it is it's kind of embarrassing to say that things aren't operating the way I'd like them to.
Right. Yeah. And so, it's okay because you're already seeing the doctor, and the doctor is going to address every issue you have. And so just raising it to your doctor is the beginning. So, your doctor knows everything about you anyway. So, talking about that is of treating you as a whole. So I make it a point when I see a patient, I always address that component, the intimacy component, and ask them, how is it going? How is it working? And it's not only for men, it's for women as well. And almost 99.9% of them say, there's something I need to improve, and can you help me? I'm so glad that you asked this question, because most of my doctors don't ask this, and I didn't know that I can do something about it.
Yeah, I like that too, because a lot of my even my woman friends will say, hey, I feel like I can't get it up either. It's funny, we don't have a penis, but it's like we have trouble getting up the urge or the push to have sex as well as we get older. And it's not just tiredness, it's just the sexual, how do you say it, just being stimulated to want to go there. Is that part of our body not being at its best? And
no, not really. The woman actually have a penis. That's actually the clitoris, but it's just shaped differently. But if you look at it histologically, it's the same tissue as the penis. It's just shaped, and 9/10 of the structural tissue is actually hidden inside your vagina. The only thing that's exposed is actually the clitoris. But the clitoris actually extends all the way back, all the way down, surrounding the whole entire vagina, and all the way even near the bladder as well. So it's amazing to find out that you have the same structure as the man, it's just more hidden. So what you were pointing to is that when women get older, they have decreased libido and decreased responsiveness, sensation in the vaginal area. And that's due to actually hormone changes. And it starts around when you're 40, your female estrogen, like your estrogen, progesterone, actually decreases slowly. So when that happens, you become a little bit drier, and the tissue is not as toned as it was when you were younger. It just takes longer, and so forth. You just feel that, hey, it's not responding. But if you recognize that I can be treated so easily with hormone replacement therapy, like bioidentical hormone, it will get you back to where you were when you're in your 20s again.
Well, I love that. I got to talk to you after we hang up about if you know any doctors in New York.
Sure.
Well, we also talked before we got started with the interview of the opioid addiction going on in the country, how much of pain management is being used through the use of pain medication, and how a lot of people are becoming addicted to it. That's part of the reason you've taken the track you have to finding a more alternative, healthier way to deal with it. How did you come to realizing it was an issue for you in your practice or in your studying or being out there with patients? Well,
I feel that I'm not helping my patient when I'm giving them pain medication. I'm actually creating a problem in the long term. And opioids are helpful during short term, but any longer than about 3 months, it actually causes more damage in creating receptor in your brain that cause more of a chemical addiction. And so I just realized that I wasn't going to be contributing to a problem for my patient, and I wanted to do something more meaningful. And that actually starts a lot of time with educating my patient from the beginning. And I told them that, the side effect, the risk of dependency and addiction, and the plan is to start and do it very short term and then weaning. And a patient knows that you're going to be there to help them along the way with their pain, then they feel that that they can get off of the medication during the journey. And we have found through our treatment that you don't have to be on opioids. You can live with some pain as long as you know your boundaries, and that we're going to do everything we can to optimize your performance and quality of life.
I love that, because I've seen often a lot of the pain medications being a Band-Aid. It's not really solving the long-term effects of wanting to live healthily in your body. So I love that you found a way to help patients deal with it in a more healthy manner. But before we end out here, I don't want us to leave without you letting everyone find out how they can get your awesome book, Erectile Dysfunction Fix, and find out more about you.
Yes. You can go on my website at www.truongrehab.com. It's spelled TRUONGREHAB.com. Or you can call this number and we can send you a copy of my book. It's 540-274-1235. And I will have everything on there that I discussed about today.
Wow. Well, this has been so informative and such a blessing to have you share all this. Thank you so much, Dr. Truong, for coming to share your great gifts today on Savvy Business Radio.
Well, thank you for having me here.
Savvy Business Radio broadcasts worldwide via a large podcast network, celebrating business owners, entrepreneurs, influencers, and successful individuals. Find out about our paid sponsorship opportunities or how to become a guest. Call 732-474-7375 or email Christina@savvybusinessradio.com.